The double bubble sign on a prenatal ultrasound is associated with Down syndrome, but which spinal defect is most commonly associated with a V-shaped vertebral column in the transverse plane? A. Spina bifida occulta. B. Myelomeningocele. C. Hemivertebra. D. Scoliosis. Answer: B. Myelomeningocele. Which of the following is the most common location for a myelomeningocele to occur? A. Cervical region. B. Thoracic region. C. Lumbar/lumbosacral region. D. Sacral region only. Answer: C. Lumbar/lumbosacral region. A 5-year-old with spina bifida and a VP shunt presents with a sudden onset of a sunset eye sign, downward deviation of the eyes. This is a clinical indicator of A. Ocular muscle palsy. B. Increased intracranial pressure, ICP. C. Normal pressure hydrocephalus. D. Tethered cord syndrome. Answer: B. Increased intracranial pressure, ICP. Which nutritional deficiency, besides folate, has been studied as a potential contributing factor to the development of neural tube defects? A. Vitamin C. B. Vitamin B12. C. Vitamin E. D. Iron. Answer: B. Vitamin B12. In a patient with myelomeningocele, the presence of a syrinx, syringomyelia, is most likely to cause which symptom? A. Rapid hair growth on the back. B. Progressive weakness in the upper extremities. C. Improved bowel control. D. Excessive sweating in the lower limbs. Answer: B. Progressive weakness in the upper extremities. What is the term for the surgical procedure performed to release a spinal cord that has become attached to the surrounding scar tissue or bone? A. Laminectomy. B. Cordotomy. C. Detethering. D. Shunt revision. Answer: C. Detethering. Which level of spinal lesion is typically associated with the ability to walk independently in the community without braces? A. T12. B. L2. C. L4. D. S1 S2. Answer: D. S1 S2. Lipomyelomeningocele differs from a classic myelomeningocele because it is A. Always associated with hydrocephalus. B. An occult, skin-covered, lesion containing a fatty mass. C. An open lesion with no skin cover. D. Only found in the cervical spine. Answer: B. An occult, skin-covered, lesion containing a fatty mass. Which orthopedic deformity of the foot is most commonly seen in children with spina bifida? A. Hallux valgus. B. Clubfoot, Talipes echinovarus. C. Flat foot, Pes planus. D. Hammer toe. Answer: B. Clubfoot, Talipes echinovarus. What is the primary goal of the Creed maneuver in the management of some spina bifida patients? A. To induce a bowel movement. B. To manually express urine from the bladder. C. To test for lower limb reflexes. D. To reduce a hernia. Answer: B. To manually express urine from the bladder. Which of the following is a frequent cognitive profile found in children with hydrocephalus secondary to spina bifida, sometimes called the cocktail party syndrome? A. Complete lack of verbal communication. B. Advanced mathematical abilities but poor social skills. C. High verbal fluency and sociability but poor reading comprehension and executive function. D. Severe memory loss. Answer: C. High verbal fluency and sociability but poor reading comprehension and executive function. The all or nothing period of embryology occurs before the neural tube begins to close. This period generally refers to A. The first 2 weeks after conception. B. The 5th week of gestation. C. The 2nd trimester. D. The 24-hour window of ovulation. Answer: A. The first 2 weeks after conception. Which diagnostic test is the most sensitive for detecting a tethered cord in a symptomatic child? A. X-ray of the spine. B. CT scan. C. MRI of the spine. D. Electromyography, EMG. Answer: C. MRI of the spine. In patients with spina bifida, a neurogenic bowel is best managed by which of the following to achieve social continence? A. Low-fiber diet. B. Scheduled bowel program and retrograde enemas, or ACE procedure. C. Chronic use of antidiarrheal medication. D. Total parenteral nutrition, TPN. Answer: B. Scheduled bowel program and retrograde enemas, or ACE procedure. During the physical exam of a patient with myelomeningocele, reflexic or spastic bladder is usually associated with a lesion at which level? A. Above the S2-S4 sacral segments. B. Below the S5 segment. C. Only in cervical lesions. D. Only in spina bifida occulta. Answer: A. Above the S2-S4 sacral segments.